This class, we are going to talk about the superficial fungal infections which occur on the skin. Okay, this is also an important class in dermatology. Now, what are those superficial fungal infections in the beginning? They are Tinea Versicolor, or Pityriasis versicolor, dermatophytic infection, and Candidiasis. So we will mainly focus on these three. First, in this class, I'll talk about Tinea Versicolor and Candidiasis, and in the next class, I'll deal mainly with the dermatophyte infection. Now, these dermatophyte infections are also known as tinea, all those different types of tinea, right from Tinea capitis, Tinea corporis, Tinea cruris, Tinea barbi, Tinea unguium. So different types are there. Okay, so let's focus on Tinea Versicolor. See here. Tinea Versicolor is a chronic superficial fungal infection of the skin, and the causative agent here is Malassezia furfur, also known as Pityrosporum ovale. Malassezia furfur is the name of the fungus which is causing this infection. Now let's know something about this Malassezia furfur. Okay, let's move further. Now see here. This Malassezia furfur is a type of dimorphic fungi. See this. The meaning of dimorphic fungi is it can remain in two different forms, yeast form and hyphae or mycelial form. And it is a type of normal flora. So this is a dimorphic fungi which can, which can be found in two forms, yeast and hyphae form, and is a normal flora. Now there is a host commensal relationship in normal flora. We all know that. Okay, so they are not that harmful. But if some environment is altered there, okay, then they can cause the infection. Regarding the distribution, it is present worldwide, and mainly young adults are suffering from this infection. It is very common in the temperate climate where the person sweat, okay, sweaty type of environment, and worldwide there is a 5% incidence. It is not very important. It's a epidemiological data. Let's move on. Now, what are the predisposing factor for Tinea Versicolor? Pregnancy is very important predisposing condition, and these pregnant ladies, they may suffer from this infection because they are a bit of hypermetabolic state and they sweat a lot. Underlying disease, okay, genetic predisposition, warm and humid climate, hyperhidrosis. If somebody is sweating a lot, hyperhidrosis, and then if the skin is greasy, then also there is a high chance of development of this type of fungal infection. So this is Tinea Versicolor. So basically, if you analyze, the main point here, or the important point is sweaty, excessive sweating, and then if that area is moist all the time. Let's move on. Now, what are the clinical features of Tinea Versicolor? See here. The symptoms and signs, the meaning of versicolor means varied color. Okay, so some of those lesions may look a little bit red. Some of them may look whitish. Some may look a bit in between. So versicolor is a varied color. This is important point. And many of them are macules, or they are in patches, or they are present around the follicle. So they are perifollicular as well. So macular, patches, and perifollicular. This follicular means hair follicle. There are fine scales of different sizes on the surface of the lesion. And the main areas are the neck, upper trunk, proximal arms, and lower abdomen as well. But neck and upper trunk are very commonly found. and even the proximal arms are common. Now, if you see the picture, it is very, very clear here. What are we talking about? See this. This is absolutely common type of fungal infection in many people, and it is not very itchy actually, slightly itchy. In the beginning, it may look red. Okay, it may look red and a bit scaly, but when we, take a good shower, I like to call it scrub shower. If you, scrub your skin, and then it may turn into this type of lesion because the superficial layer of the skin is lost. Okay, and it simply looks like this. So see that it looks like a patch. Okay, uh, mainly hypopigmented in color, but in the beginning it may look a little bit red as well. So this is a very closed view. Okay, magnified or closed view. See these scales here, these are called scaling. Okay, and this is, the appearance. This is a big patch here. Now, these are, some other, pictures of Tinea versicolor. These are confluence. Okay, confluence of these patches, and sometimes it is very commonly confused with another disease which may look similar. What is the name of that skin condition which almost looks like this? Yes,
Vitiligo.
very good. Vitiligo, exactly. Now, how do you separate vitiligo and tinea versicolor? Very easy question. Yes, how do you separate?
Sir, vitiligo usually asymmetrical and they are less in amount, while this Tinea Versicolor are asymmetrical and large patches usually.
Okay, okay, good. And what investigation
It
you
is
like?
in pit, or we
Is
can say history. In
vitiligo
pit,
is autoimmune condition.
Good. Now, your answer is, very good. See there? Sometimes only we are confused. Like it is a smooth looking patches. See this smooth looking patches are vitiligo. And a little bit, if we look it very closely, there are some small, like uh, papule formation are there in this tinea versicolor. Very small elevations are there on the skin. Okay, this is first point. And second is right. Vitiligo is a patchy type of distribution. Here and there, it is present maybe around the mouth. Okay, periocular we say it's one of the common site. Another is finger, the extremities. Vitiligo patches are very common there, and very rarely it is present in a large area. Whereas tinea versicolor usually, it is present in this area, anterior part of the chest, in the basal area of the neck, upper back. Okay, these are the common site. Now, second, I will definitely take help of investigation. If I take a scraping of the skin and do KOH mount, okay, in the lab, I will see spaghetti and meatball appearance in case of tinea versicolor. That is the diagnostic point in here. Whereas in case of vitiligo, there is loss or absence of melanocyte. These melanocytes are the melanin producing cell. They are damaged or destroyed because of the autoimmune mechanism. Okay, so questions may be asked like this to you. Okay, so just think for a moment and answer. You are in a very good track. Now see this. This is again another closed view which is showing tinea versicolor, and sometimes it may look simply like this, a bit of red colored macule. Okay, so that's why the name versicolor probably. Different types of color or varied color are there. This is another picture. See this? This is a very common area, okay, around the ear also and around the neck. Now, what investigation we like to do? So the first one is a KOS mount. This KOS mount or KOS preparation, we say, will give us the diagnosis. So how we do that? We take a scraping from the skin, okay, and we do KOS mount. and we see under the microscope. We'll see hyphae and budding yeast spore, just like spaghetti and meatball appearance. So let us see what is that spaghetti and meatball appearance look like. Now see here, this is a very common picture which is shown in different exams these days. This is the yeast form. These are the mycelial or the hyphal form. So this is meatball appearance. Here is the spaghetti appearance. So this is the KOH mount, okay, preparation. So this is a very typical of Malassezia furfur. Apart from them, Wood's light examination can be done. This Wood's light examination is a special type of examination technique in case of dermatology. So relatively dark environment is maintained, and a lamp is placed, okay, on the affected area of the skin. Now, according to the disease or according to the damaged skin, the different color will be formed there. The skin just flourishes according to the different skin pathology. Normal skin will not change any color there. If there is a change in color, we know something is wrong there. Okay, so it is just a type of screening thing. You think like that. It is not a diagnostic type of investigation or examination. After that, we suspect, yes, something is there. Then we do some other test. Culture can be done, but this is not routinely done in clinical practice. So see this? This is a colonies of Malassezia furfur and Dixon cigar. Okay, only the theoretical importance. Practically, spaghetti and meatball appearance with that classical clinical feature is enough for us. Now, what are the differential diagnoses of Tinea Versicolor? One is vitiligo. Just now we discussed about that. Another is Hansen's disease. What is Hansen's disease? What is another name?
Leprosy.
Exactly. Yes. Hansen's disease is called leprosy. Okay, it's another name of leprosy. So it is caused by Mycobacterium leprae. And there are different types of leprosy. One is called tuberculoid type, another is called lepromatous type, and third is called borderline type. Tuberculoid, lepromatous, and borderline. So tuberculoid leprosy has a hypopigmented patch on the skin, and it is commonly confused with this type of problem. But one very important point is there. In tuberculoid leprosy patch, there is no sensation. Sensation is lost. That is a hallmark of leprotic patch, whereas sensation is present here. And other tests you can do for leprosy. For example, you can take a smear from there and prove that it is caused by acid fast bacilli. Another is post-inflammatory hypopigmentation. See that? Post-inflammatory hypopigmentation. Now, this is a very common condition. If we have some wound, okay, or some lesion on our skin, after that got better, there is a bit of hypopigmented area or patch developed there. And it can simply be confused with a small patch of Tinea Versicolor. If it is a bigger area, of course, we are not confused. It looks very different. But a small patch in the beginning may be confused. And Pityriasis alba is another condition which is quite common in children, especially the face area is affected and there is a white patch on the face. Okay, Pityriasis alba. Alba means white. Now, regarding the treatment, it is very easy. Okay, diagnosis and treatments are quite easier. Though this is a common infection, treatment is easy here. Topical and systemic, both types of treatments are available. And these are the topical treatment like ketoconazole shampoo. Ketoconazole shampoo, okay, are applied on the local area 2 times a day for 2 weeks. Or ketoconazole cream are also available. Whatever is convenient for the patient, we prescribe. Another is called selenium sulfide suspension or even shampoo form. Okay, this shampoo is also, or suspension is also applied on the local area around 5 to 10 times, 5 to 10 minutes. It is kept there after application every day, again for 1 to 2 weeks. So these are topical treatment. Apart from that, fluconazole, okay, or itraconazole, these are the systemic therapy which can be tried. Now, another part of the superficial fungal infection on the skin, which I am going to talk today, is candidiasis. Now, this is caused by Candida albicans. Okay, Candida albicans is a type of fungus. Okay, this is also a normal commensal which is present on the surface of our body or even inside the body. Now, see that they are the normal inhabitant of skin, mucous membrane, and even the GI tract. That's why we call them normal commensal. This normal commensal do not usually cause the infection on their own. There is a harmonious relation between them and our body. But if the environment change in that particular area, if there is some damage, some other disease probably, okay, if the population of them are increase because of the decreased population of some other bacteria, then there may be infection. So mucocutaneous infection caused by candida can be acute, chronic, or systemic. What are the predisposing factors for superficial candida infection? If the local environment is very humid, okay, warm and humid, there is excessive moisture on the environment, then it can result in a lot of sweating. So this is one of the risk factor of candidiasis. If we use drugs like antibiotics and oral contraceptive pill, then also these are the predisposing factor for candida growth. Okay, especially these antibiotic, we use unnecessary antibiotic for a longer time, then I already told you the balance between the harmful bacteria and harmless bacteria or microorganism will be altered, and that can simply lead to overgrowth of those organisms there. Pregnancy, diabetes, obesity, Cushing syndrome, debilitated condition means somebody is very sick and they are in the terminal phase of their illness, and immunocompromised state. All of these can be the predisposing factor for superficial candidiasis as well as disseminated candidiasis. Now, this debility and immunocompromised state is for disseminated type of candidiasis or systemic. For example, remember the AIDS patient. We have oropharyngeal candidiasis, esophageal candidiasis. That is much more serious condition rather than one small patch on the oral cavity or some other involvement of the skin. Now look at this slide. It is quite interesting. See this infection. Okay, for example, infection occur on the body, isn't it? Any type of infection, maybe bacterial infection of any type. We use antibiotics for the treatment. Those antibiotics will not only kill those pathogenic bacteria, but they can also wipe out the friendly bacteria, means the normal commensals which we need. And then there will be overgrowth of the candida. This candida will damage that particular part of the body by producing different toxins. Their own pathogenetic mechanism is there, and during the course they can weaken the immune system, and then again some other type of infection can happen. So this is a type of vicious cycle, and we have to break this cycle somehow, either by early treatment or by treating this infection nicely. Now, what are the clinical features of candidiasis? See here. There may be different types: acute mucocutaneous candidiasis, chronic mucocutaneous, and systemic. So in this class, we only focus on the mucocutaneous form. Now, acute mucocutaneous candidiasis is quite common, and they are usually present on flexural area. Okay, flexural area means fold area, like axilla and the groin. Paronychia and oral or genital lesion can also be there. We'll talk about one after other. Paronychia is around the nail bed, oral cavity, and genital lesions in the genitalia. Now, flexural candidiasis is also known as candidal intertrigo. Candidal intertrigo is the synonymous term. So see there, intertrigo. The common site for this candidal intertrigo are skin folds like axilla, groin, and the wave space. Not only them, some of the inflammatory skin fold. For example, there is inflammation going on the surface of the skin, and that has lead to edema formation or swelling of the skin. Now there is formation of skin fold there, and in that skin fold also fungal infection can occur. This wave space are the very common areas for candida infection, like in the foot, okay, in between the toes we have infection there, in between the toes. Okay, so especially if those areas are moist, okay, then this candidal infection is very common. And that what exactly happens in the rainy season. What happens if we are only slippers or even our shoes, if they are wet for a long time, then the wave space between the toes are never dried up. They always remain moist, and that is the situation or environment where candida just flourishes. Okay, the candida can get infection or cause infection there. So the lesson to be learned is keep those areas dry. They look very erythematous and macerated. The skins are peeled off and they look quite wet. This is called macerated appearance. If we examine clearly, there will be scaling, and at the edge of the lesion, some satellite pustules are present. Some small pustular like appearance, which are known as satellite pustules, they are also typically present in candida infection. The main problem is at the center, and satellite lesions are present on the periphery. Please mute yourself. Now look at the picture here. See, this is what we are talking about. This is the intertrigo, okay, wave space. See, this is the macerated type of appearance. In the acute stage, it looks red. It looks very wet, but only macerated area is seen here. And see this. This is another a flexural area which is very red. This is the acute involvement. Okay, it looks moist, and all these smaller patches are there. Another type of candida infection is paronychia. Now see this. This is the paronychia form. Okay, to explain it nicely, let's see the anatomy of the nail bed first. So this is the nail plate. You can clearly see here. Below the nail plate is the nail bed. Okay, this is called lateral nail fold. This is the eponychium, and from there the nail grows actually. So this is like a germinal epithelium for the nail plate. This is called lunula, and this is the cuticle. This is the part of the skin there. So the important points here are nail plate and the nail folds. So paronychia is a soft tissue infection around the fingernail. For example, these nail folds are acutely inflamed. Sometimes pus discharge comes out from there, and they are very tender. If this is caused by candida, we call it candidal paronychia. So tissue infection around a fingernail is called paronychia. So some predisposing factors for this are the wet work and diabetes mellitus. So diabetic people are, having this type of infection in many parts of the body. So if somebody is working, in water, if their profession is that, for example, the person who washes clothes, okay, the person who works like that, they are the common candidate for having paronychia. In this condition, the fingertip is red and tender as well as swollen, and sometimes there is post discharge as well. If we examine the nail plate, they become yellow, green brown, and the nail plate is ridged, or in other words, it doesn't look healthy. Okay, it doesn't look healthy. Anyone can distinguish between the healthy nail plate and the uh, infected nail plate by the fungi. Now let's look some of the picture here. Okay, maybe we have included that later on. Now let's move on. Let's talk about genital candidiasis. Genital candidiasis, probably in gynecology you have studied a little bit about them. These are very common in female, especially in female. And candidiasis or vaginal candidiasis in female gives rise to one particular discharge that is called curdy discharge. That is quite typical question in the exam. So the predisposing factor for them are diabetes, pregnancy, taken of oral contraceptive pill, and use of unnecessary antibiotics. So all of these are predisposing factor for genital candidiasis. This is a sexually transmitted infection. So if one partner is diagnosed with this type of diseases or infection, both partners should be treated. Always remember this. This is a principle of treatment of sexually transmitted infection. The other partner may argue, I don't have any infection, why should I go for the treatment? And you say, no, till now you don't have infection, but you are probably in the incubation period, who knows? This is the way to counsel them. Vulvovaginitis is the presentation in female that can cause itching and white curdy discharge. Whereas balanoposthitis is the term we use for male. Balanitis and posthitis. This is the inflammation of the glands and prepuce. Okay, so if we examine closely, there are formation of papulopustules with erosion. And another important feature may be after the sexual intercourse, there may be pain and the burning sensation on the genitalia, and that genitalia look erythematous. These are the features of genital candidiasis. Now let's talk about oral candidiasis. Oral. Now see there are different forms of the oral candidiasis. The acute pseudomembranous oral candidiasis is called oral thrush. Okay, oral thrush, very common term in clinical practice. Oral thrush means oral candidiasis in an acute condition. It forms a membrane there. We call it a bit like pseudomembrane. Angular stomatitis, the angle of the mouth is affected, and another term for this is perleke. Perleke or angular stomatitis. Third is acute atrophic type of candidiasis because of the depapillation on the tongue. Okay. Tongue has different types of papilla. So those papillated areas will lose the papilla. We call it depapillated area. And another one is a chronic atrophic type of candidiasis, which results in erythema of the palate and edema. So these are the different types. In the clinical practice, the oral thrush is very common. Now see there, look at this picture here. This is an extensive type of candidiasis of the oral cavity, extensive. And this patient is having AIDS. It is written there. So see this, these all are the patches of candida in the oral cavity. Now, if any patient comes to you like this, don't only think about candida. Think about why such extensive candidiasis occur in this patient. What is the reason behind it? What may be the mechanism? And you have to think about uh, this immunosuppressive condition and take a detailed history about the risk factor and things like that. And if necessary, take the consent from the patient and send for the ELISA or Western blot analysis also to confirm HIV and AIDS. But never send that without the consent of the patient. That is not appropriate. Another picture. Look at this. See this. This is the thrush or the patches of Candida, okay, inside the mouth. Here is another one. Here is the patch. Highly typical. Now, let's move further. We are coming towards the end of this class now. This is chronic mucocutaneous candidiasis, and this is actually a clinical syndrome and which may, occur in the family in a different member of the family as autosomal recessive disorder. Autosomal recessive disorder. It has genetic susceptibility, and one very important point here is it is seen commonly with endocrinopathy. Now, multiple disorder of the endocrine glands like hypoparathyroidism, Addison's disease, and even thymoma. Now, one common reason you can give here, these endocrinopathies, especially hypoparathyroidism, is sometimes associated with absence of the development of the parathyroid as well as thymus gland. Okay, absence of the development. And if there's something wrong with the thymus gland, or if thymus gland is not developed, this person will have cell-mediated immunity deficiency. Okay, decreased cell-mediated immunity. And cell-mediated immunity is, if it is deficient, then different types of fungal infection, different types of viral infection may be common. So I'm just giving you an explanation by how you remember these type of things. But other reason may also be there. Sometimes it just run in the family as autosomal recessive disorder. I already told you. Now, in this condition, there is persistent infection in the skin, mouth, and nail bed. Now, see there, this is chronic mucocutaneous candidiasis. Okay. These nails are chronically infected, and nobody said these nails are healthy. Okay, in one look, probably this is a fungal infection. Now, another important question comes to is there are two types of fungal infection which can cause this type of problem. One is Candida, another is dermatophyte, which we are going to talk in next class. Dermatophyte tomorrow. So, how to differentiate them? We should take the help of investigation. Okay. Just clip the nail and send to the lab. Ask them to do the necessary test, and they will give you the report whether this is Candida or dermatophyte. Systemic candidiasis occur in severe illness and severely immunocompromised people. Okay, and they may be associated with severe or widespread cutaneous and visceral infection. Visceral infection can also be widespread here. Now, what investigation you like to do? The answer is very easy. It is KOS mount again. And what type of fungi are Candida? Yes, according to the classification, which type of fungus are they?
Yeast-like.
Yeast-like.
fungus.
Very good. They are yeast-like fungus. Excellent. So we have four types of classification: yeast-like fungi, okay, hyphae or mycelial, and dimorphic fungi. Among them, they are yeast-like fungi because they have got a bit of a pseudo budding type of appearance there. Culture can be taken from the lesion and then sent to the lab, and you should always rule out diabetes and immunocompromised situation if there is extensive growth of the Candida. Now, final part is the treatment. Now, treatment is according to which type of Candidal infection is this. If this is a case of paronychia, see this, paronychia, we give ketoconazole, clotrimazole, or miconazole in the oral form. Okay, oral form, they are important because this paronychia is a nail involvement and it takes many weeks to month to treat. So only topical is not enough. At the same time, give antibiotic because some post discharge is coming from there and some secondary bacterial infection is very common. Protect the patient from wet work or advise them do not indulge themselves into wet work. In the intertriginous lesion, you give topical imidazole group of drugs like clotrimazole or miconazole for substantial period. What we say, till you get completely better, keep on apply the medicine because these medicines are not harmful. We have given them topically. Medicated powders can also be given. And there are one extra advantage of medicated powder. They can make that area dry as well. And maintaining the local hygiene and maintaining the dryness is very important. This is for intertriginous lesion. Regarding the oral thrush, we can give clotrimazole mouth pent. This is a special type of preparation which is available. Clotrimazole mouth pent or buccal rinses. Okay, you can give up to 5 times a day for 2 weeks. Another drug is nystatin. Another is oral fluconazole, and another one is itraconazole. Whatever is your choice, you can go for. But in the beginning, we always start with clotrimazole buccal rinse or mouth pent, and these are the alternative or reserve type of drugs. Now, in case of female, if vulvovaginitis is the problem, then we can go for clotrimazole vaginal tablet or vaginal pessary, we say. Miconazole is another option. Can go for oral fluconazole in a bit of serious type of condition. This is a systemic antifungal drug, or even oral itraconazole is another option. So different choices are there. Okay. So at the end, I will provide these questions for you regarding your homework. So let me stop here. Thank you, guys. We'll see tomorrow.